Hi everyone, welcome to week 12. This week we're talking understanding measurement. Before we get started, again, a couple housekeeping stuff. We're used to this by now. Just a reminder that assignment 2 is due this Friday, 7:59. Once again, don't leave it to the last minute. If you have any questions, let me know sooner rather than later. We can get that sorted out. For some of you have asked me about how do you submit the dashboard. There's a couple different ways. You can submit the Power BI file itself. The portal should let you submit it that way. Otherwise, all else fails, take a screenshot of it and put it in the Microsoft Word document or the document that you're submitting your one-page justifications for the indicators. Put it in there, submit it all at once. That's probably the easiest way to do it. That being said, you don't need a title page for the assignment. If you have it, or if you put it in, you already submitted it, don't worry, you're not going to get docked marks, but it's not necessary for this one. The last thing is the final exam. So final exam will happen during the exam period. It will be structured in the exact same way as the midterm. It will be on the lockdown browser. You have the entire exam week to complete it. You get one shot, right? So make sure you have a good connection, your laptop's plugged in and charging, all of that good stuff. Again, multiple choice, true and false. You will have 2 hours to do the midterm. Or sorry, not the midterm, the exam. Same sort of thing. If you have any questions beforehand, let me know and we can go through that. The exam will be cumulative, so it will include material from before the midterm. So everything is fair game. Strong focus on lecture material. And with that, let's dive into the lecture.
Now let's move on to understanding measurement. So why is measurement important? Measurement is basically our heart and soul of our evaluation, right? Our performance measurements are going to influence the way things are done on multiple levels, okay? So it's going to influence the operation of the organization as a whole. It can influence how a specific job is done, depending on what those measurements tell us. It can also influence the culture within the organization, depending on what you measure. It can influence the attitudes of the staff, and the big one, it can influence the decision-making process. Now, if you're not making data-driven decisions, you are doing a disservice. So measurements provide that data for the decision-making. Always being able to rely on your measurements in terms of decision-making is going to take you further than if you just do things like some managers I've actually heard use the whole philosophy of trusting their gut. And that's fine. It might work for some people. I would highly discourage that approach for a multitude of reasons. I would always encourage decision-making based on data-driven processes. Now, any measurement that is used must always come back to the business and organization. Okay, so we don't want to just take random measurements and measurements that might not apply to whatever it is that your organization or business is dealing with, right? That makes it essentially useless. We can think about our research processes and protocols of generalizability, right? Now, on top of that, as much as it should always come back to the business and the organization, it should also link to the specific strategies and objectives, right? I should have a purpose for this information. If I'm taking measurements and it has nothing to do with my objectives, then what am I really doing, right? If I use kind of that long-term care example that I tend to rely on, if I'm trying to tackle my objective of limiting falls and I collect data on hand hygiene, what am I doing there, right? It's just all I'm really doing is wasting time unless I'm also looking at hand hygiene protocols for a different objective. I'm wasting time and resources and realistically have no business taking that measurement. So we always want to make sure that our measurements are focused, right? Think about the lean principle, right? We want it to be focused. We want to eliminate any kind of waste in terms of the process of taking the measurement. Link it back to strategies and objectives. Now, these items are what traditional organizational measures look like. Now, things have changed, so there is some we say creativity now with taking measurements, but we're going to talk about kind of the priorities for measurements in a little bit. But these are ones that have been used in the past. Effective, some of them, not necessarily all of them, as I hope you can see very quickly. So, for example, focus on financial reporting. This has a very specific success, right? Obviously, an organization or a business needs to be financially successful, so there needs to be some sort of focus on finances. However, as we've been seeing kind of as time goes on, is that businesses and organizations that succeed also have more to it than just financial reliability, right, or financial growth. There are things such as culture in the workplace, staff retention, so on and so forth that are important. That leads us to the next thing, focusing on minimizing variance. So this is actually one of the really good ones from traditional organizational measures. Variation is not a good thing, necessarily, I should say, at least in the context of what we're talking about. So we want to focus on minimizing that variance. The next, focusing on short-term cost reductions. Now, this has been kind of shown to be, I don't want to say the wrong way of thinking, because I'm sure there is one avenue in which this is a beneficial way to look at things. However, now kind of the general consensus is we're looking long-term. Sometimes looking long-term means taking short-term costs up front for a longer-term benefit, okay? This will go down to the philosophy of the management and really what they're trying to accomplish. But this one is one of the ones that can be argued back and forth. The next one, measurements that do not necessarily tie in with the needs of the customer. Well, as we've kind of talked about in the past, the customer is key. So this one, probably not the most reliable one. Next, traditional organizational measures do not relate to most employees. Well, if we go back to that first bullet we talked about, now we know that successful organizations and businesses are focusing more on their employees' health, well-being, the culture within the organization. So we really should be switching our focus to relate to most employees in terms of our traditional, or in terms of our organizational measures. And the last one, may or may not align with strategic goals. Well, we talked about that on the last slide. All measures should lead to kind of the strategic goals. Now, when you're defining what measurements you should use, there are a couple priorities that you should focus on. Now, we just highlighted the traditional organizational measures. Like I said, some of them are good, some of them I would steer away from myself. However, this is also going to be situational. So a few of the guidelines to kind of think about when you're developing your evaluations and what measures to define, you really want to focus on a few vital strategic gaps. So you really don't want to sit there and throw kind of mud at the wall and see what sticks. You want to focus on a few strategic gaps that you've identified at a time. That's not to say that you can't eventually tackle them all, because that's kind of your job, is to eventually fill in all the gaps and make sure that everything operates smoothly. However, if you're not focusing on a specific small detailed chunk at a time, there is a chance that you're just going to create more gaps, and it just becomes this kind of like cat chasing or dog chasing its tail kind of thing, right? You're never going to make progress because every time you fill a gap, another one opens up. Focus on a few of the vital strategic gaps at a time in order to eventually piece everything together. Now, another priority is linking organizational objectives, key objectives, and improvement activities. So again, we want everything to tie back to what the organization is kind of aiming to do and what that specific focus is. The next one is measurements are developed from policy development processes. Basically, again, this kind of goes back to the objectives, key objectives, and improvement activities, policy development. So you have to look at the culture within the organization as well. This is basically saying like it has to relate to what's going on within the organization. Now, the next is focus on meeting the daily operation target with an expected level of quality. The next, identify consequences of missing key targets. So you want that measurement to be able to let you know what's going to happen if you miss your key targets, right? So what happens in the event of failure, if there's a failure that exists? And then the most important one is focusing on root causes. So a lot of the time, most of the issues you're going to encounter in a process or a procedure has a root cause. One, two, maybe three causes cause a whole host of problems. And there are different tools that you can use to get to that root cause, but you must focus on the root cause. By doing that, you're going to eliminate maybe not even one problem, but several problems at a time. So this is why that one's specifically highlighted. Now, you should understand that without these points addressed, your measurements taken will be useless. Again, let's look back at the example I used. If I'm focusing on fall reductions in long-term care and I'm taking measurements based on hand hygiene compliance, I'm missing the target completely, right? Now, there's no metric that I can think of where hand hygiene compliance is going to relate to fall prevention. Now, does that mean that hand hygiene compliance isn't important? No, not at all. We need to focus on hand hygiene compliance. However, that is not the current strategic gap that I'm looking at right now, right? It's not my objective. So should I be collecting those measurements if I'm on the team looking at fall reductions? Probably not, right? Those measurements are completely useless. I need to be focusing on things that actually relate to the objective, such as I might even look at the quality of shoe that the residents are being provided. I might be looking at the time period of the scheduling of mopping of the floors. I might be looking at antipsychotic use, so on and so forth. We've gone over a million examples of that. But I have to make sure that the measurements I take are actually going to be usable within what I'm setting out to do. This brings us to our secondary priorities. So once we have our first priorities met, we can start refining our measurements a little bit more and focus on these priorities, such as focusing on lead time reduction and delivering response to a competitive weapon. Now, we accomplish these priorities by reducing waste, eliminating inventory, having one piece flow, reducing changeovers, and minimizing flow. So these are all things that we've talked about. I believe it was in the previous lecture. If not talked about directly, everything related to these metrics. From secondary, we move on to tertiary priorities. So this is the cornerstone of improvement, and this is where we really start to focus our attention on reducing variation. So the reason for this is because variation is typically the root of many of the problems. And so we focus on reducing variability in all forms of the process. By doing so, by mainstreaming everything, we can usually get to the root of the problem and fix it completely. Now, with these in mind, we can also split the organizations of healthcare into a few different levels, and then this is going to help us further to define what measurements we should use, how we should use them, realistically what's of particular interest to us. So our first level that we're going to focus on is level 1, the system or hospital. Okay, so these measurements in this level, they're typically outcome measures. So again, keep in mind that every organization is going to be different, and so you may have unique measurements. Now, below are 3 kind of themes, and then different examples for each theme. Please note that this is not all the options available. It'd be impossible to list any and every possible variable or measure. Okay, so you can have financial measures, which in terms of the hospital or system, again, this is going to be different depending what you're looking at, can be cost per case. You can look at things like net revenue, cost per visit, so on and so forth. In this piece, we're really focusing on that financial aspect, financial accountability. The next one is quality itself. So you're looking at, for example, adverse effects. So this can be pharmacological. You can even look at things like in the OR, what are the adverse effects after a knee replacement, right? Where you have to worry about infection and acceptance of whatever it is you're putting in. There's falls, which we've talked about a lot. Number of codes, okay? So like a code blue or whatever it is, where staff have to respond to them, because the number of codes that are occurring of a specific code type might yield implications into the quality within that hospital. For example, I believe it's code white is a violent patient. If you have high numbers of code whites, maybe there's something going on with staff that is aggravating the patients, right? A little bit different if you're working in kind of a mental health setting where you're working with patients who might be prone to aggressive outbursts, right? Depending on what it is that they're dealing with. But in your typical hospital setting, if you're getting a lot of code whites, you're going to want to look into, okay, what's going on here, right? Same with if there's a lot of code blues where you have to do CPR if there's a higher number than usual. Well, what's going on? That's not necessarily saying it's something to do with the staff, but maybe it does have something to do with wait times in the ER, right? If someone's coming in with a heart attack and they're not getting seen in time and then they're coding, and this is happening at a higher rate, well, something needs to change, and that speaks towards the quality. You have things like meta errors, which are very severe. And so as soon as you start seeing a lot of meta errors, that's something you're going to really want to pick apart very quickly. And then there's satisfaction. So of course, for the customers, for the staff, and for the physicians. So remember, if we think back to traditional organizational measures, we're getting away from just focusing on the cost and the finances, although that's still included here. It's still an important piece, but we're getting away from that. We're looking at the satisfaction of customers, staff, anyone involved in the process, because that also has implications for the quality and, in a sense, success of the organization. All right, so now we have level 2, which is departments. So we're getting a little bit more specific now. So each department should develop a scorecard based on their level 1 measures. So you start with your level 1 measures, then you're going to go to the specific departmental levels, okay? Now, they can be the same as the level 1 measures depending on the context of the department, except there's going to be more subcategories where it's appropriate to do so. Now, again, this is where your measurements are going to get more specific, okay? So you can have an overall hospital level 1 measurement of wait times, but when you look at it from a different departmental perspective, such as comparing OR and ER wait times, they are going to differ, okay? So the surgical, like the OR, might be interested in, for example, time from, let's say, not necessarily diagnosis, but agreement to treatment to actually getting on the OR table, right? Whereas ER, your wait times are going to be the time from when that person steps foot in the building to the time that person is seen by a doctor, okay? Still wait times, but two completely different contexts. Now, additional measures can include things like service, so appointment timeliness, number of missed appointments, so on and so forth, or it could look at leadership development. So we're looking at things like internal promotion rate, percentage of staff trained in a specific service or skill, so on and so forth. Key elements that will lead to the development of the staff. Because one thing that we have to be aware of, it's much more effective and appropriate to promote from within than to look for an external hire. And this is true both from a time perspective and from a cost perspective. So things to also keep in mind. That's more of kind of an HR issue. Sometimes you will be asked to get involved in those kinds of things as well. Now, level 3 is operational issues, so operation specific. Typically, a team's measure for a lean project with specifically outlined targets and objectives. Okay, so now we've really focused down with our spotlight. So this allows for a proper understanding of the variation that's occurring. So if you think about wait times, having very short wait times as opposed to very long wait times and everything in between, it gives a general understanding of the measurements that you're using as well. Okay, so at the end of the day, what we really need to understand is that we measure for one of two reasons. We're either doing monitoring measurement, right? So we're making sure everything is operating as planned, or investigatory measurement. We're going to talk about these two things in detail next. Okay, so monitoring measurement, these are measurements made over long periods of time, and they're done in order to identify trends and variations. So again, you're going to look at something to see what is going on and see if any kind of outlier starts to develop. So these kind of measurements must take into account several considerations. The first is the measurement should identify the presence of problems, but not necessarily the cause. So we're not looking at doing root cause analysis here or looking into why certain trends are occurring. We're just looking to identify those trends, okay? So again, let's think of the falls example. I will do monitoring measurement for each resident, or it might be by unit, looking at the number of falls that are occurring, okay? Now, what I will see is I will have kind of a standard because falls are going to occur. It's just natural, especially in long-term care. Now, what I'm looking for are variations in the trend, okay? So first thing that happens is over a long period of time, I develop the trend that's considered normal, and then any variation in that trend is going to spark my attention. At this point, I'm not necessarily aware of the cause of it, right? I just know that there's a change in falls. Then I'm going to start looking into the cause, okay? This brings the next point. The measurement should not be intrusive or interruptive within the processes. So it's not like I'm going to go to the unit and disrupt how things are done there when I'm looking at number of falls. I'm just trying to identify if something is going on. It is something that I can take a high level approach from, I can step back, and I can just observe. These measurements should also be repeatable. So because we're measuring for long periods of time, it has to be repeatable in the same exact manner to have valid data. And then lastly, measurements should be taken on a regular basis, which again makes sense. You need it regularly in order to identify trends. In my case, I was able to take these measurements monthly and view my data from that perspective. Now on the flip side, we have investigative measurement. So these are done specifically to identify the cause or determine more information about the problems that we might have identified in monitoring measurement. Now this differs from monitoring measurement because these measurements can be intrusive and disruptive. Like again, we're looking to dive deep into the problem and see what the cause is, and that will most likely, I should say, cause disruption. Again, if I look at my falls kind of analysis, I might actually go to the floor that's experiencing the most number of falls, and I'm going to start asking nurses and PSWs what's going on. I'm going to observe residents. I might be in the room of a resident to see, how that nurse is providing care, because if they're not doing proper care, or if a person is a resident, I should say, is like a two-person lift, and nurses and PSWs are only doing one-person care, that's a significant issue that I need to address. Now, no extra attention is paid toward cost. What that means is you're going to put more money down in investigative measurement because they have to be a little bit more intensive, right? We're diving deeper into a problem. It's going to require more time and money. Now, the information can be either quantitative or qualitative in domain, okay? So just like research, each quantitative or qualitative domain has its function, its benefit, and its drawbacks. So it's up to the evaluator to really understand what they need more of for each particular circumstance. Now, on top of all of this, there are components of measurement that we need to consider. So when trying to figure out what measurement to use or what to utilize, we need to think about the scale. So the scale is going to help us determine the range of possible measured values. So if we're expecting, for example, if I'm looking at anxiety, right, as a measure for an outcome, and I'm really expecting a population with high levels of anxiety, I'm going to want to include a tool that has the ability to capture that range of anxiety, okay? Or another good kind of example of that is if I'm expecting a population that has very large variations within their anxiety reporting, I want a tool that's going to capture across that range of values that I'm expecting. We also have target. So the measure which signifies adequate performance or achieving objective. So this can be central measures or at either extreme. So you want to identify the target for the values that you're collecting. Then there are limits. So any values beyond kind of these limits are called no-go values, and we don't include or consider them. For example, I did a study on physical activity, and now the tool that I used looked at physical activity over the span of a week. So my no-go values would be negative values because you can't do negative amount of physical activity. You can do 0, but you can't do negative amount. And then, so my top measure, like my top limit, would be the maximum number of, I think it was in hours for that study, but the maximum number of hours per week, right? Because if anyone reports they're doing more physical activity than there are possible hours in a week, obviously there's something wrong with that measure. Now it gets a little bit more complicated because with something like physical activity, the limits are probably going to be, or you have justification to have a lower limit, right? Because once you take into account like time to sleep, time to study, all these other things, chances are you're not going to have anyone report physical activity even above 2/3 of the maximum number of hours in a week, kind of thing. All right. This is going to range, again, depending on what you're measuring. And a good way of finding out the appropriate limit is either to look at the literature to see what others have done and see what common practice is, or to consult with experts. The next is tools. So these are items that facilitate the measurements. The good news is there are a lot of really good tools out there that can help capture measurements that you're looking for. If not, tools can be developed for the specific measurement. Okay, so furthermore, in order to understand how a set of measured items behaves, they must all be measured and included within the analysis. The thing is, this rarely happens, and this rarely happens for a few reasons. The first is the cost to measure all of the items, okay? And the cost can either be financial, it can also be in terms of time, and it can be in terms of participant ability or engagement. So what I mean by that is, often when we like to give out questionnaires, whether it's research or evaluation, and we want to capture all the information possible, it's sometimes hard to keep the participants' attention span for long enough to answer all the questions. Now, this is problematic because I can't accept half-completed surveys. So, in the research that I just told you about with physical activity, we had something like 150 questions, okay? We could have had that questionnaire expanded to 300 plus questions to capture all the measurements that we would have liked to have had. However, we had to reduce it because if we kept it at 300, the chances of completion drop dramatically. So for that reason, we have to sometimes pick and choose what we measure. The second reason is maybe not all items are available for measurement. This does happen where it's just impossible to measure. Third is that there may always be one more measurement to make. So that is in certain problems, and this happens, I believe, to everyone at some point in their evaluation or research career. As you are going down the list of things that you want to investigate or measure, there's always one more thing that pops up, right? There's always one variable that's connected to another variable, which then ends up being connected to another variable. And before you know it, you have like 30 variables that you want to collect because they are all interconnected. For those who might be taking global health or non-communicable diseases right now, we've talked about web of causations. And web of causations can explode very rapidly, right? You can have a lot of moving parts associated with a particular disease, whether it's non-communicable or infectious. Ideally, we would like to collect information on all those little parts of the web. This is most of the time impossible to do. And so with that being said, you have to focus on a select few. Now, the other thing that happens is that sometimes measuring the item effectively destroys it. So this is kind of seen in twofold. The first one is through what's called white coat syndrome. And this happens, ironically, you can all kind of experience this firsthand. When you go to the doctor's office and you're going for a checkup, and that doctor goes to take your blood pressure, what happens is there are people that get nervous because the doctor's taking their blood pressure. They're worried that blood pressure is going to be too high. Well, what happens when that happens? Your blood pressure increases. So just by the act of someone taking that measurement is poorly observed, right? The same can be said about heart rate. And honestly, it might work now if you guys want to try it now, but it depends on the circumstances. So check your pulse, get your heart rate, then do it again with the idea of, I want to make sure that my heart rate the second time is below the first one. If it means something to you, you'll start to stress out a little bit and you can actively ruin the measurement through that stress level. That's kind of an example of the white coat syndrome. Another example can be seen in the world of physics. So not so much applicable to us in terms of healthcare quality, but in the physics domain, one problem that they've had is that in certain ways of measuring characteristics of certain atoms and particles, through that measurement, it actually alters the behavior of that particle and so they don't get a real read on it. It doesn't effectively destroy the particle itself, but it makes it behave differently, so whatever it is that they're trying to measure is effectively destroyed. So just two kind of examples of how measuring the atom can effectively destroy, I'm going to say, its value, not its being entirely. So what do we do in these circumstances, right? We want to measure everything, but we can't physically do it. So one solution is through the use of a limited sample in which the characteristics of the other items can actually be deduced by what we measure, okay? So essentially taking proxies, right? So to do this, we need to keep two things in mind. The first is our sample must be large enough to be representative of the items from the population. And, excuse me. And the second is the sample must be selected completely at random. So these are the two criteria that we need in order to kind of bypass this limitation that we have surrounding the data that we can collect. Now, whenever we execute something repeatedly, whatever is produced is hardly ever identical to the previous iterations. Okay, so I can do the same thing 100 times and it's never going to come out the same. And we can look at this in terms of, like, for example, think of music, right? I can be well versed in playing, let's say, guitar, right? I can do a solo, the same solo, 100 times. Now, if I line up that solo, speaking specifically in terms of like recording that solo, if I line it up, the recording is never going to be the exact same. There's going to be variability, and now it might be minor variability. That variability we might not be able to detect with our ears, but if we look at the sound wave itself, it might be a millisecond off. The pitch might not be at the same level across the entire solo. There's so many different variables encompassed within that recording that something is going to be off. Okay, now the thing with variability is that we have a certain tolerance for it, right? We expect variability within our day-to-day lives. It's when we have large differences in that variability that it becomes a problem. Okay, now the thing with variability is that if the source of the variability can be understood, then we can do something about it, okay? So for example, in terms of music, one thing that we've tried to use to limit that variability whenever either we're recording or playing with others is the use of a metronome, right? Something computerized that actually takes into account the time and is as precise as possible. And that's one way we can limit the variability in terms of, in the musical sense, musical example that we used. Now, limiting the variation within a process is going to allow for the reduction in rejection and failure among the processes, okay? So it's ultimately leading to the reduced costs. This is referring to that large range of variation that occurs, right? Again, we're always going to have a very small amount of variation in whatever we do. That's okay, right? If we think about our normal distribution, typically we can see between one standard deviation on either direction. That's not a big deal, right? It's when we have these really large outliers in variation that are going to cause problems, and those are the ones that we want to limit. Now we have things that are common variation, and then we have special variation, and we're going to talk about these in 2 seconds. Okay, so common variation. Common variation cannot be modified, and this is rarely eliminated because they're typically a result from natural randomness occurring. Now, this picture, it's probably from a movie that's older than most of you. This is from Jurassic Park, like the original one, not the new sequels that have kind of ruined the franchise, in my opinion. But in this, one is a paleontologist, the woman's a paleontologist, the man is a mathematician, and he's talking about something called chaos theory. And so essentially chaos theory talks about these random variations, right? If you watch the movie, what's going on in this scene is they're actually talking about common variation. What he's doing is he's taking water and he's dropping it onto our hand. And what he's showing is that due to, in this case, the variation in the skin, every time he drops a droplet of water onto her hand, it's going to flow down her hand in a different direction. this is a source of common variation, okay? So there's nothing that can be done to change this variation. It's at a very microscopic level, but every time a drop of water hits this woman's hand, it's going to flow down her hand in a different direction, okay? This is just the natural randomness that's occurring. We then have special variation. So special variation is what occurs outside the normal occurrences. This is like an adverse event that occurs, right? Think about the I think it was the big 5 mistakes or errors in the surgical suite. These are special variations outside normal occurrences, and these can be addressed due to the avoidance of those special conditions, right? So one thing, for example, is with aviation, what was happening, and this is like way back in the day, so it's not a problem now, but pilots would drink, and they would drink way too close to before they flew a plane. And by that I mean by like a number of hours, not like, you know, have 3 shots of whiskey and fly a plane. But what would happen is that alcohol would still affect them, even though they weren't drunk, and it would lead to errors in the air. So what do we do now? We impose a no drinking limit within a specific time frame, right? We eliminate that special variation. Of course, you get normal occurrences that are going to cause for minute errors or variation in no plane is ever going to land the same way all the time. However, what we're doing is we're taking out the special variation, right? A pilot cannot drink 12 hours before they get into the cockpit now because of these things, right? So that's one kind of example of special variation. Now, lastly, when we look at data, we have things called skewness and kurtosis, and this talks about variation within the data. So skewness, and we're talking about normal distribution. Skewness is the amount of shift that the distribution is displaying in regard to the mean. So what we see here is if the skewness is less than 0, you're going to see the data skewed left, okay? If you see the skewness is 0, we get a normal distribution. Greater than 0, it's skewed right, okay? Now, this doesn't really have much implication for us in terms of equality overall. This more so goes towards data analytics and when you look at performing your statistical analysis. However, this is just to keep in mind that this is one kind of viewpoint of variation that you should pay attention to. Okay, so the last thing we're going to talk about is kurtosis, so the amount of spread in relation to normal distribution. So what this tells us is kind of the range of values, and it's showing us the frequency. If we have very much an even distribution or among the range, what we get is platykurtic kurtosis, right? So value greater than 0, which means flatter tails. Mesokurtic is our normal distribution, and leptokurtic means a sharper peak, which there's more people that are kind of aggregating towards the mean value. Again, we're looking here in terms of variation. So something that is leptokurtic, there's not a lot of variation going on, whereas something that's platykurtic, you're seeing more variation. So again, things to keep in mind when we're talking about variability.
All right, and that's it for content for this week. I know it's getting late in the term, so it's perfectly placed for a nice short and sweet lecture. So once again, remember, assignment 2 is due this Friday. Final exam, I've given you all the information that you need for that. If you have any questions, I cannot stress this enough, ask ahead of time. We can sort it out, especially with the exam. If something goes wrong with the exam and you email me right before the window closes to complete the exam, I cannot help you. That's just kind of how it is. Make sure that you hit submit, make sure that it saves. And my advice would be, if you have that kind of spare moment in the first half of the exam week or exam period, get it done then. With that, have a good rest of your week, and we will talk next week.